Professor Duffy, can you give us an insight into what the public's attitudes are to spending on health intervention measures?
Yeah, I mean, so what Michael's work does so brilliantly is outline how interconnected these issues are, of inequality generally to inequality in health and obesity specifically. You can't deal with one without dealing with the other. So that makes public understanding and public consent for those types of major interventions really important. But we've got a couple of problems with public perceptions of this. The first group of problems is we've got lots of misperceptions about the scale of the problem. We still underestimate the scale of obesity. When you ask people how big an issue is it, how common is it, and we also underestimate the inequalities that Michael outlines so well. People haven't quite got their heads around the scale of these inequalities and how it's linked to those more structural factors. As Michael says, we do tend to have a more individualistic mindset on this when we're thinking about inequalities in health.
Meaning people think, well, it's a choice.
It's your choice.
If you eat junk food, it's a choice.
It's a behaviour, a lifestyle type choice. Or they go to health services. They say it's to do with the quality of the health services that you've got locally, not about these broader determinants of health. And that's an issue because we need public consent to see that we need those types of interventions. There is some good news because we are seeing these kind of long waves of shifts in opinion where in the 1980s people were not willing to spend more on taxis to deal with health and education, those types of things. Then it kind of rose up to the mid-1990s where we reached the peak of 2/3 of people saying, actually, we do need to spend more. Then it kind of declined again down to the mid-2010s, where it's only 1/3 of people saying we should be spending more than we currently are.
So that's after the financial crash,
after austerity, all of those types of measures, it was kind of going down. But then it's since the impact of austerity has been fully felt by people from the mid-2010s, it's gone up again now, and we've got a majority of people saying, actually, we should be spending more on health
that's
and
interesting.
education.
So the pendulum swung back again.
We get these long waves of the pendulum swinging, and we're in a much more fruitful environment for those types of discussions.